Hey guys, it's me, Professor D, and welcome back to my channel. If you haven't done so already, please be sure to like, comment, and subscribe below. On this video, it's going to be short. I'm just going to go ahead and finish off those questions that we started on maternity, okay? So we're going to just jump right into it. So first question. Which action by the nursery nurse would warrant immediate intervention by the charge nurse? 1, the nurse allows an experienced volunteer to rock the infant. 2, the nurse puts a gloved finger into the newborn's mouth. 3, the nurse performs the ortolani maneuver on the newborn. Or 4, the nurse requests the LPN to bathe the newborn infant. And I'll give you a moment to think of your answer. And the correct answer is 3. The nurse performs the ortolani maneuver on the newborn. Guys, the only person who's allowed to do this, the only professional, is the physician or the nurse practitioner, okay? RN, LPN, CNA cannot do this. Now, this ortolani maneuver, that's when they're checking for hip dysplasia, right? But this is a newborn, so you don't want to accidentally displace the hip, okay? So a trained professional such as the physician or the nurse practitioner is the only one that's allowed to perform this maneuver, all right? Next question. The charge nurse is making assignments on the postpartum unit. Which client should be assigned to the licensed practical nurse? 1, the client who has delivered her 6th baby and has just returned to her room. 2, the client who had a C-section yesterday and is running a low-grade fever. 3, the client who had a vaginal delivery this morning and has foul-smelling lochia. Or 4, Or 4, the client who's 1 day post-vaginal delivery who's ambulating in the hall. And I'll give you a moment to think of your answer. And the correct answer is 4, the client who's 1 day post-vaginal delivery who's ambulating in the hall. Why? This is the most stable client. Look at your other choices. You have number 1, the patient who delivered, the patient who has delivered her 6th baby and has just returned to her room. She just had the baby. She just returned to her room. So guess what? That patient's going to need a lot of in-depth assessment. You want to make sure that patient's not bleeding out. You want to make sure the high blood pressure doesn't get too high. In-depth assessment, so the LPN is not going to get that patient because that's not the most stable patient. You have 2, a patient who has a low-grade fever. That patient's not stable. And then you have 3, foul-smelling lochia. No, you're thinking infection. So that's not the most stable patient. So that's why you're going to give the LPN to choice 4 because that is the only stable patient in those 4 choices. Next question. Which behavior by the unlicensed assistive personnel warrants immediate intervention by the postpartum nurse? 1, the UAP helped the client with the episiotomy, apply an ice pack to the perineal area. 2, the UAP pushes the PCA button for the 8-hour post-op C-section client. 3, the UAP uses non-sterile gloves to remove the client's peri-pad. 4, the UAP encourages the client to eat all of the food on the breakfast tray. And the correct answer is 2, okay? Can anyone but the patient press that button on the PCA machine? No, all right? So that CNA that pressed the button for the patient, they're going to need follow-up teaching, okay? Any patient that has a patient-controlled analgesic device, as a nurse, you have to teach the patient and the family that only the patient can push that button. And you have to explain that because the patient might be asleep and they're moaning in their sleep and the mother's there or family members there and they feel like the patient's in pain and they'll want to press the button. But guess what? If the patient was really in pain, they would have woken up from sleep, right? So you have to teach them. Nobody presses the button except for the patient. Next question. The charge nurse is making assignments on a postpartum unit that has registered nurses, 2 licensed practical nurses, 2 unlicensed assistive personnel. Which task assignment is most appropriate? 1, instructing the UAP to evaluate how the mother and infant are bonding. 2, telling the RN to change the sharps container in the medication change room. 3, ask the LPN to administer ibuprofen to the client experiencing afterbirth pains. 4, request the LPN to care for the client who's 6 hours postpartum who had eclampsia. And I'll give you a moment to think of your answer. And the answer is 3. Why? Because this patient is the most stable and is getting what's routine. Remember, LPNs, you have to give them the most stable patient and meds that would be given routinely. So of course, if a mother just gave birth, she's going to have afterbirth pains, and ibuprofen is not even a narcotic. This is analgesic that can be given as a routine medication. Now let's look at our other choices. 1, telling the UAP to evaluate mother and infant bonding. Well, remember I told you, only the RN is allowed to eat, EAT, evaluate, assess, and teach, right? So you're not going to give that to the CNA, so we got rid of that. Then you have 2, telling the RN to change the stripes container. No, that's for environmental, okay? That's not for the RN. Then you have 4, requesting the LPN to care for the patient who's full 6 hours postpartum who had eclampsia. Absolutely not. This patient is 6 hours postpartum, and they're going to need in-depth assessment. So an RN has to see that patient. So number 3 is the only one that's appropriate to give to the LPN. Next question. The nurse is caring for a postpartum client in the taking in phase. Which intervention is most appropriate for the nurse to implement? 1, ask the client to demonstrate how to change the infant's diaper. 2, determine if the client's blood is Rh negative or Rh positive. 3, allow the client to ventilate feelings about the birth of her infant. Or 4, discuss the advantages of breastfeeding over bottle feeding. And I'll give you a moment to think of your answer. And the correct answer is 3, allowing the client to ventilate feelings about birth of her infant. Now, the taking in phase, guys, this is after mom has given birth, okay? And this is the phase where it's all about mom, okay? She's not ready to learn. This is not the time to try to do teaching with her. This is not the time to try to extract information from her, okay? This is the time where she just gave birth. This was a traumatic, sometimes it's a traumatic experience, right? So the mom's going to want to talk about how she feels, and this time is all about her, and you want to focus it on her. So this is a time that you want to allow her to vent how she feels and what she thinks, you know, the next couple of weeks are going to be like, her expectations, her worries. This is a time for her to talk about herself. Now let's look at our other choices. You have 1, asking the mom to demonstrate. No. This is not the time to do teaching or ask for return demonstration. 2, determining if the client's Rh negative or positive. This is not the time. This is all about mom and her feelings. That is the taking in phase. Or 4, discussing the advantages of breastfeeding. Again, you're not teaching. You're not asking for return demonstrations. You're not trying to garner information from the mom about, you know, in order to get a physical assessment. This is a time that you're allowing the mom to talk about her feelings, because during the taking in phase, mom is very self-absorbed. It's all about who? The mom, okay? Next question. Which action by the nurse warrants intervention by the charge nurse on the postpartum unit? 1, the nurse offers the Muslim client a ham sandwich and salad for lunch. 2, the nurse asks the Seventh-day Adventist client if she needs anything for her Sabbath on Saturday. 3, the nurse offers the Asian client who's febrile hot water instead of cold. 4, the nurse explains to the Jehovah's Witness client who's Rh negative that Rogam is a blood product. And I'll give you a moment to think of your answer. And the correct answer is 1. What needs further teaching is offering the Muslim patient a ham sandwich. Patients who are Muslim, they do not eat pork or pork products, okay? But everything else is appropriate. Look at 2. Seventh-day Adventists, they worship on the Sabbath, which are Saturdays. So that's very appropriate to ask them if they need anything for their Sabbath on Saturday. 3, the Asian client, many patients in the Asian culture, they believe in the hot and cold. So if a patient is febrile, offering them something warm instead of cold, because if you offer them something cold, to be polite, they'll accept it from you, but they won't use it, okay? They believe that the heat has to be in harmony with heat and cold in harmony with cold. That's what they believe in, balance in the hot and cold. And then you have number 4, also appropriate, the Jehovah's Witness. They do not accept blood or blood products outside of themselves, okay? So patients who are Jehovah's Witness, when they come in, what often happens is we'll take their own blood. So if later they need a blood transfusion, we can transfuse their own blood, because traditional Jehovah's Witnesses will not accept blood or blood products outside of their own bodies. Next question. The client being seen in the OB clinic tells the nurse, I don't think it's right that the judge is making me get a contraceptive implant just because they don't think I'm a good mother. What ethical principle does the requirement violate? 1, autonomy. 2, justice. 3, fidelity. Or 4, beneficence. And I'll give you a moment to think of your answer. And the correct answer is 1, autonomy. In nursing school, you learned about what you as a nurse are allowed to do autonomously, right? What does autonomy mean? That means to make decisions on your own without any outside influence. And this is a perfect example. This is violating the mother's autonomy. They're taking away her rights to make her decisions over her children. So let's look at the other choices. 2 is justice. Another word for justice is fairness, okay? So treating one patient the same way you treat another. 3 is fidelity. That is another way of saying keeping your commitments. Okay. So if you tell a patient, I'll be back in 5 minutes, you keeping that commitment and coming back in 5 minutes, that's a form of fidelity. Okay. You're keeping your commitment. And then you have the beneficence. That means to do good. What you do for your patient, you're doing it for their well-being, for their health. Next question. The client who delivered twins 3 days ago calls the women's health clinic and tells the nurse, I'm having hip pain that makes it difficult for me to walk. Which statement is the nurse's best response? 1, I'm going to make an appointment to see the healthcare provider today. 2, this often occurs a few days after delivery and will go away with time. 3, are you performing Kegel exercises 10 to 20 times a day? 4, the pain may decrease if you empty your bladder every 2 hours. And I'll give you a moment to think of your answer. And the correct answer is 2. This occurs a few days after delivery and will go away over time. So what happens is sometimes it takes a couple weeks. For some moms, it takes a couple months. And what happens eventually is that the ligaments, the bones will shift back into the pre-pregnancy stage. But as it's happening, sometimes it can be very painful, very painful. So that's something you have to teach to the mom, that within a couple weeks, some moms with a couple months, it's going to go away as those ligaments and the cartilages, they shift back to its pre-pregnancy stage. So what the healthcare provider usually orders for that are simple analgesics for the pain. Let's look at our other choices. 1, I'm going to make you an appointment with the healthcare provider. That's not necessary. This pain is very normal. We see this after pregnancy, and you just explain that to the mother, and you explain that it's going to go away on its own. 3, are you performing Kegel exercises? Well, guys, we know those Kegel exercises, that's to strengthen the sphincter. Well, that sphincter has nothing to do with the pain that mom's experiencing right now, because the pain that mom's experiencing right now, as I said before, it's from the ligaments and the cartilage shifting because of the pregnancy and it going back to its pre-pregnancy state. And then you have the 4th choice. What was our 4th choice? The pain may decrease if you empty your bladder every 2 hours. It's important. You want them to empty their bladder every 2 hours, but that's not going to decrease their pain that they have. Okay, so the correct answer is 2. Next question. The 36-week gestational client has just received a stillborn infant. What intervention should the nurse implement? 1, call the sudden infant death syndrome support group. 2, refer the client to the maternal child case manager. 3, notify the hospital chaplain for fetal demise. 4, contact Child Protective Services. And I'll give you a moment to think of your answer. And the correct answer is 4, notifying the hospital chaplain for fetal demise. So guys, you call a chaplain whenever a patient has any kind of spiritual need. And by the way, that chaplain is not affiliated with any one religion, okay? It's just any spiritual needs that the patient may have. And obviously at this time, if mom delivered a stillborn infant, okay, she's going to be very sad. So it would be appropriate to call in the chaplain. Look at our other choices. 1, calling sudden infant death syndrome support group. Well, we're told in the question that the patient was a stillborn. So it's not sudden infant death syndrome. It's not like the baby was born alive, was sleeping, and then when mom went to check on the baby was dead. That's not the situation. Then you have choice 2, maternal child case manager. Well, what the case managers, what their job is to do is to make sure that there is a seamless transition from the acute care unit, such as a hospital, to home or rehab or wherever that patient is going. So this would not be appropriate because that baby was stillborn, okay? And our last choice was called protective child services. What are you doing? Or do you suspect that mom abused the baby? No, this was a stillborn. So the most appropriate answer out of all of these choices are to call the chaplain to help the patient with any spiritual needs that they may have. You want to at least offer that service to the patient. I can't believe, well, I did say this was going to be a short video. Just a few more questions. Next question. Which client should the labor and delivery nurse assess first after receiving report? 1, the client who's 10 centimeters dilated and 100% effaced. 2, client who's exhibiting early decelerations on the fetal heart monitor. 3, client who's I cannot pronounce, I'm sorry guys, vacillating about whether or not to have an epidural. Or 4, the client who's upset because her obstetrician's on vacation. And I'll give you a moment to think of your answer. And the correct answer is 1. That's who you're going to be running to. Guys, look at this. She's 10 centimeters dilated. Guess what, guys? You can't get any more dilated than 10 centimeters, right? And she's 100% effaced. You can't get more effaced than that. That baby's coming. So that is who you're going to be running to first. Choice 2, early decelerations. That's a good thing. They can wait. Choice 3, mom facilitating about whether to have an epidural. Well, she's just thinking about it, but she's not in any acute distress. She can wait. And then, of course, 4, the mom who's upset that her OB is on vacation. This is not an acute situation where she's in harm's way. Okay, so who you're going to be running to is mom who's about to give birth, 10 centimeters dilated, 100% effaced. Next question. The nurse is caring for clients in a women's health clinic. Which client warrants intervention by the nurse? 1, the pregnant client whose H&H is 1133. 2, the pregnant client whose fasting blood glucose 110. 3, the pregnant client who has 3+ protein in her urine. Or 4, the pregnant client who has WBC of 11,500. And the correct answer is 3. The client who has 3+ proteins in her urine. Guys, remember, I don't remember which video this was I was doing with you, but we do not play with protein in the urine. We do not play with blood in the urine. We do not play with leukocytes, WBCs in the urine when mom is pregnant. If mom's not pregnant and she's asymptomatic, she's not going to go on antibiotics, right? But if mom's pregnant, even if she's asymptomatic, if we do a urine finger stick and we see blood in the urine, we see WBCs, we see protein, that's a problem. And guess what? Mom's going to go on antibiotics. We're going to do other follow-up with her, okay? Why? Because we can't take any chances with that pregnant mom having protein in the urine, finding out mom has preeclampsia. We can't take a chance with mom having WBCs or RBCs in the urine and bacteria creeping up. And before you know it, patient's got pyelonephritis. There's a whole slew of issues that can possibly happen with mom being pregnant that we are not taking any chances with. So we're running to that pregnant mom that has 3+ protein in the urine, okay? That's who we're running to. Now let's look at our other choices. Pregnant client with H&H in 11 and 33. Well, because she's pregnant and she has such a huge fluid shift, we expect to see those numbers, okay? And what happens is when they're pregnant, they tend to have something that's called hemodilutional anemia. Okay, and that's very normal with pregnancy. So we tend to see those numbers. We're not going to be running to them. 2, fasting blood glucose of 110. You want the fasting blood glucose to be 70 to 110. So she just made it, but we have more pressing matters, that 3+ protein. So that we're not running to that patient first. And then we have the pregnant client whose WBC's 11.5. Now, it didn't say WBC's in the urine. It just said WBC. So through the blood stick, we saw the WBCs were 11.5. And guys, I explained this, I think it was in my first video on maternity, or maybe it was another video, I don't remember. But I did explain to you guys, when mom's pregnant, we expect to see those WBCs, especially after she gives birth, okay? Surge. It may surge up, even up to 25,000. You know, normal's 5 to 10. Right? But after she gives birth, we might even see it go up to 25,000, and that's normal. And then what's going to happen, it goes all the way up and it's going to whoosh, shoot back down within a day or two, 48, 72 hours. Okay, so the WBCs being slightly elevated at 11.5, we're not going to be running to them first. The first person we're running to is that patient with 3+ urine. Okay, we're worried about preeclampsia. All right. Last question. A client's 1 day postpartum, and the nurse notes the fundus is displaced laterally to the right. Which nursing intervention should be implemented first? 1, prepare to perform an in and out catheterization. 2, assess the bladder using bladder scanner. 3, massage the fundus for 2 minutes. 4, assist the client to the bathroom to urinate. And I'll give you a moment to think of your answer. And the correct answer is 4, assist the client to the bathroom to urinate. Guys, the number one reason for displaced bladder, for displaced fundus, right, is a full bladder. That is the number one reason. So the first thing that you're going to do is have mom urinate. After she's urinated, okay, and if you notice that that fundus is still displaced, if you notice that it's a little soft or boggy, you're going to massage. All right. But the first thing you're going to do, if you see the fundus displaced, have mom empty her bladder. That's the number one reason for a displaced fundus, is having a full bladder. Guys, this was part 2 of my maternity questions. I hope these questions were helpful to you. I kind of chose these questions because they were a blend of maternity and priority and delegation. And I know a lot of you students have an issue with priority and delegation. I hope you guys found it helpful. Please, if you haven't done so already, like, comment, subscribe below. Any videos that you'd like to see me cover, just go ahead and put in the comment section and I'll make sure I get to it for you. Thank you so much for joining me, and I'll see you next time.